Hello, everyone. Thank you for joining. My name is Lacey Hong with the Alberta Medical Association, and I will be moderating today. Next slide, please. Please note that the session you're participating in is being recorded. By participating, you understand and consent to the recording being made publicly available via a link on the AMA website for an undetermined length of time. Today's conference will include a presentation followed by a question and answer period, and there will be no chat. We will be using the raise hand feature during the Q&A portion of today's session. Next slide, please. We would like to recognize that we are webcasting from and to many different parts of Alberta today. The province of Alberta is located on Treaty 6, Treaty 7, and Treaty 8 territory, and is a traditional meeting ground and home for many Indigenous peoples. Following the presentation, there will be an opportunity to ask questions. To ask a question during the Q&A period, you will need to raise your hand using one of the displayed methods. This can be done using your reactions button within your Zoom control panel or by locating the More option. Once you've raised your hand, you will be added to the question queue. I will call you off mute and you can pose your question to the panel. Next slide, please. I'd now like to introduce Dr. Scott Beach and Dr. Cheryl Mack for introductions and opening remarks. Dr. Beach, please come on camera and off mute. Dr. Beach? Let me see if I can just get Dr. Beach off mute here.
Hello?
Oh, we can hear you now, Dr. Beach. Would you like to turn your camera on? There we go.
Yes, good morning. I received a call and it bumped me out there. My apologies to everyone in attendance, and good morning to everyone on this beautiful spring morning. I'd like to first open with some thanks to the Alberta Medical Association for providing the platform for this important discussion this morning, and to my colleagues at the Edmonton Zone Medical Staff Association for taking part in this point of this journey, and for all their hard work leading up to this discussion that we're about to embark on. And I want to offer my personal thanks to Dr. Cheryl Mack, the Vice President of the Edmonton Zone Medical Staff Association, for acting as a co-host for this important endeavor. Before we begin today, I would like to emphasize the importance of this morning's discussion by highlighting a few points from my personal experiences as a frontline care provider during COVID-19. As a family physician, I have humbly journeyed two pathways of care. During both of these, the challenges faced by our fellow Albertans could fill the narratives of two distinct books that, if written, would speak to their experiences during these extraordinary times. The first I would title The Book of Loss. Over the past year, myself and my fellow family physicians have counseled, consoled, and commiserated thousands of our patients as they've worked to reconcile their personal losses experienced during COVID-19. Young Albertans whose graduations were never realized, new grandparents who've yet to meet their first grandchild, and owners of small family businesses that have served their communities for decades, whose doors are now closed. Each of those examples, and indeed the losses experienced by each and every Albertan, would stand as poignant entries in the Book of Loss. Tragically, as a member of the intensivist service here in Calgary, I have borne witness to stories with even sadder endings, stories would fill the narrative of the second book, which I would title The Book of Sorrows. As an ICU outreach physician, I have met many patients in the emergency department who begin their COVID journey with the ability to speak. In a short time, they require a tube and ventilator to breathe. Not long after, they are dead. It is my sincere hope that the recommended actions coming out of this morning's review of the data and modeling will be combined with our fellow Albertans' sacrifices and ongoing perseverance in such a manner as to bend the curve of the third wave here in Calgary and indeed across our fine province, helping to prevent any further tragic entries into the Book of Sorrows. With that, it's my distinct pleasure to introduce our first speaker this morning, Dr. James Talbot. Dr. Talbot is one of the co-chairs of the Strategic COVID-19 Pandemic Committee of the Edmonton Zone Medical Staff Association and is an adjunct professor in the School of Public Health at the University of Alberta. Dr. Talbot.
Thank you very much, Scott. Thank you for setting the tone for this presentation so beautifully. And I too have a fervent hope that at the end of this, we'll be able to put a close to the Book of Sorrows and to the Book of Loss. So I've been asked to present a public health perspective on the Calgary COVID-19 data trends. I'll try to keep it brief because the speaker who comes after me will be talking about what we can expect to see in the future, and that's more important. But if we could go to the next slide. This is a slide showing as of April 4th what the activity in Calgary looks like in terms of COVID-19 cases per 100,000. Calgary is being hardest hit of all the zones right now. And the message is pretty much the same for all the slides. Where it is currently is more than twice as high as the peak of the first wave in terms of hitting Calgary, and about 2/3 of the way up to where the second wave finally crested. And so, and you can see that it looks like the slope of it is happening faster, which Dr. Kasparowicz will deal with in her presentation. This is also a good news slide because it shows that when we've worked together as individuals and as leaders, whether it's business leaders or religious faith leaders or people who are involved in municipal leadership, that when we all get together, we can bend the curve back to the point where it's decreasing. Next slide. This is kind of an inside baseball slide, but it's very important. It is a percentage of positivity of the tests that are being done for COVID. And you can see that it undergoes the same kind of waxing and waning we saw in the previous one. But the key is that anytime you're above 5%, in public health, that's usually a signal that we have to stop doing targeted measures alone to bring an outbreak under control, that we have to move to society-wide kinds of measures if we're ever going to get the numbers back down. And you can see that in Calgary at over 8%, it's now close to being the worst positivity rate that it's been in the last year. And so a signal that we need to go to harsher measures. Next slide. These are the cases in hospital, and you can see that there's a slow but steady increase in the number of active cases that are in hospital, and once again, well above where we were in the first wave and a substantial way towards the maximum amount of activity that we experienced in Calgary, which was in December. And if you cast your mind back to that time, that was a time of immense stress on hospitals. Next slide. This is the slide that shows most distinctly why the variant is so important in terms of our thinking about how to get control back. The variant wasn't contributing much to the first and second waves, but it is contributing to the third wave. And you can see that we're already at about 40 out of 55 cases towards what we saw in the peak. And that's a very rapid rise. And it's likely related to the fact that the variant is known to cause more serious disease. So not only does it cause disease faster, which means that that slope is closer to straight up than we should be comfortable with, but it also means that percentage-wise, the pressure on the ICUs is going to happen faster. Next slide. So the good news, though, is that beyond the fact that we've brought 2 waves under control, the good news is that the number of deaths is staying relatively flat. That has a lot to do with making sure that the people who are most likely to die got immunized in the Calgary zone, and that the people who take care of them have also been immunized. And so that is a positive, absolutely. But even with the measures that the government announced yesterday, we would like people to recognize that the stress on hospitals, the stress on ICUs, and more importantly, the stress on people in the community who still are capable of getting COVID and getting long COVID is still going to require more work on our part. And I'm going to hand off to my colleague, Dr. Kasparowicz, who's been doing excellent modeling from the very beginning. And she's going to take us a little bit about what the future looks like unless we do something significantly different starting today.
Thank you, Albert. Allow me to introduce our next speaker this morning, Dr. Gosia Gasparowicz, who is a developmental biologist from the Faculty of Nursing at the University of Calgary. Dr. Gasparowicz.
Good morning. I would like to present the COVID spread dynamics in Calgary. This graph shows the daily new cases in Calgary over time. The black dots are new cases. It's in the second wave during our fall surge, they were doubling every 2 weeks. So we had doubling, they grew from just in 1 month from 80 cases on October 14th to more than 400 cases on November 14th. And then in just 3 weeks, they reached the peak of 760 cases on December 6th. Then the cases started to go down, and it was thanks to the strong public health restrictions introduced, especially on indoor spaces. Then cases were going down, halving every like 3 weeks. And then in February, restrictions were eased. And then, not surprisingly, cases started to grow up again. And now we are in the third wave with variant, the red rectangles here, doubling every 1 week. So what is important, it's variant cases are doubling every 1 week. Cases in the fall surge were doubling every 2 weeks. Next slide, please. What is special in this third wave, that it consists of 2 subwaves. One, represented here by blue dashed line, is the subwave of original variant that is doubling every 3.5 weeks right now, which is still fast. But what is most dangerous is the wave of the new variant, the red dashed line, which is doubling every 1 week. Cumulatively, they give the blue solid line of overall cases. So the new variant, the B117 or so-called UK variant, is doubling every 1 week. So it's very fast. It's taking over and it drives the surge. So, and it's very consistent. Now the growth rate is very, very consistent, doubling every 6 to 7 days. So basically, if the conditions won't change, then we can expect 1,000 daily new cases in Calgary by mid-April and around 2,000 by the end of April. So here the very important question now is what measures we need and how strong they need to be to to bend this red variant curve downwards. Next slide, please. So the UK variant is around 36% more transmissible in Alberta, which means that its R value is 36% higher than the R value of original variant. R value tells us how many people on average one infected person will infect. So if R value is above 1, that means that the epidemic grows exponentially. And if it's below 1, it means that the epidemic is under control and it's declining. This graph shows the projection or projection trajectories for the new variant, B116 variant, starting from 1,000 cases under different restrictions. So the purple line is the restrictions from the winter, January, December, and January restrictions that we had in Alberta. Under such restrictions, the variant, they won't be enough to bend the curve downwards, the variant curve. It will still grow. It will be a little bit slower in the term that it won't double every week, but it would double every 2.5 weeks. And doubling every 2.5 weeks is what we've seen in the fall surge. If we have restrictions like during last spring shutdown, we would barely bend the curve. The cases would halve every month. So we would need to get from 1,000 to 100 daily new cases in Calgary, we would need 3 months. So basically to really substantially and quickly bend the curve and reduce the daily new cases, we would need some restrictions of the strength of New Zealand, Australia, basically full financially supported lockdown. And then we can get from 1,000 cases to just a couple of daily new cases in just 2 months. But the most important message here is that the restrictions from winter, the measures from winter, won't be enough to bend downward the variant curve. We would need at least the restrictions from and the measures from spring shutdown last year, which included, as we remember, that they included closures of many non-essential things, including in-person schools and including places of worship. So basically to bend the curve, we would need at least the package of restrictions, of measures that we had last spring. Thank you very much.
Thank you, Dr. Gasparowicz. I would like to introduce our next speaker this morning, Dr. Craig Jenny. Dr. Jenny is an assistant professor in the Department of Microbiology, Immunology, and Infectious Disease at the University of Calgary. Dr. Jenny.
Thank you, Dr. Beach. Next slide, please. I thought today I would just try and put a little bit of perspective on these models. I think the models are very clear. I think what the models show is that restrictions are absolutely necessary to avoid very rapidly overwhelming healthcare capacity in Alberta. I think the models are arguably also very conservative. We're modeling the B117 or the UK variant spread in those models. And in the last week, we have now seen community level transmission of yet another variant, which is arguably even more infectious than the B117 variant. So I thought instead of looking at the overall model, I would present just a single snapshot, numbers that were made available in Alberta province-wide on Monday, the day before the government decided to bring in additional restrictions. I think that this immediately conveys the situation we are currently sitting in and what the next few weeks present here in Alberta. If we look at the number of new cases that we are seeing in our daily reporting, these have tripled in the matter of 1 month. So within the month of March, our new cases have more than tripled. Our active cases, infectious people in the community, has more than doubled. And critically, we currently hold the most active cases per capita of any province in Canada. This is a stark reminder. Other provinces have moved much quicker and much more restrictive with fewer infectious individuals in the community. In Alberta, we have more active virus than any other province. On Monday, our test positivity rate was nearly 10. The number we saw yesterday was over 10. And as Dr. Talbot pointed out, this is problematic. This suggests targeted restrictions are going to be ineffective, but it also suggests that we are missing significant numbers of infected people in the public. A test positivity rate of 10 means we are not capturing all the active cases. Our intensive care units have almost tripled in a matter of a month. So we are once again facing this critical health burden. Perhaps from an infectious disease point of view, the most concerning numbers, though, are this contribution by the variants. So as of this week, 40% of all active cases in the province of Alberta are due to variants of concern. This means that these are growing more rapidly than the original strains of virus. And in fact, Alberta has more confirmed cases of variant infection than any other location in Canada. So this is a pressing problem here that has to be immediately addressed. And finally, as pointed out in the charts, our R value is now approaching, and as of yesterday has eclipsed 1.2, suggesting that we are in a very strong exponential growth phase of the virus. We had discussed earlier in March that unless this curve began to bend, there would be no options left but restrictions. And unfortunately, we have reached that point now in Alberta. And with that, I will pass off to our next speaker.
Thank you, Dr. Jenny, very much. Our next speaker this morning is Dr. Daniel Niven. Dr. Niven is an intensive care physician at the Peter Lougheed Center and an assistant professor in the departments of critical care medicine and community health services at the Cummings School of Medicine. Dr. Niven.
Thanks, Dr. Beach, and good morning, everyone. And thanks for the opportunity to be here today to share my experience caring for patients with COVID in the ICU. As mentioned, I'm an intensive care physician in the Calgary zone. And today I'd like to speak to my own experiences and personal observations over the past year caring for COVID patients, though I know through many informal conversations, my thoughts are similar to many of my colleagues. So during this segment of the presentation, I'd like to make two important points, and I don't have any slides. I'm just going to talk to them. First is just how concerning the third wave, owing to variants of concern, should be to Albertans. Not only are variants of concern more communicable and efficient at spreading within populations, but recent data shows very clearly that for the B117 UK variant, they're also more lethal, with a 60% increased risk for hospitalization, 100% increased risk for admission to the ICU, and a 50% increased risk for death. Importantly, these increased risks associated with infection with B117 are not confined to the typical populations who might be predicted to suffer an adverse outcome owing to COVID, particularly elderly, frail, and medically complex, but rather these severe outcomes are observed among young, healthy, working individuals. It could be a parent, sibling, aunt, or uncle. Variants of concern are non-selective in whom they infect and create life-threatening illness. In the past week on call in our ICU, we cared for those aged 20 to 60 years, all with severe COVID, not one with a pre-existing health problem. Some made it out of the ICU after a period of time on the ventilator. Some did not, and unfortunately died. Others are still there fighting for their life. Many are already there for several weeks. And of those who survive, some will manage to return to their normal means of living, caring for themselves, going to school, working, whatever it was, things we consider a basic tenet of life. Others will not, and may be profoundly impaired, both physically and mentally, for considerable periods of time. And the second point I'd like to make is that role Albertans play in saving lives. In order to give everyone who needs hospital services the best chance for a good outcome, we healthcare providers need the help of all Albertans. Your actions do save lives, and though you may not know it at the time, or are just simply fed up with all the restrictions, your actions are directly responsible for lives saved. The actions you took over Christmas holidays to reduce or even eliminate social gatherings saved the lives of many Albertans during Wave 2 and gave our teams a chance to help those that were fighting for their life. Now more than ever, we need your support. In Wave 2, hospitals and ICUs in Alberta were pushed to their limits to care for the many patients who entered the system, particularly the large number with severe COVID-19. We pushed our physical space as well as the capacity of our personnel. COVID is exhausting. Caring for patients sick with COVID requires the help of many. Observations thus far among patients infected with variants of concern is that they require additional care due to the fact that the B117 variant causes more organs to fail than its predecessor. All of this threatens to push us beyond the capacity we operated at in wave 2, which will threaten our ability to provide care for all patients who need hospital services, and from an ICU perspective, could lead to the implementation of triage protocols, wherein committees using models and outcome predictions will decide who gets into an ICU and who gets to stay. So finally, I'd like to plead with all Albertans to continue to follow public health restrictions, and please get your COVID vaccine as soon as you're able. Don't let your guard down. Variants of concern will take advantage of this. Tempting fate with the variants of concern will result in more unnecessary death and disability at a time when vaccine rollout is positioned to help protect us and move toward a more normal life, one that we all anxiously await. Thank you.
Thank you so much, Dr. Niven. Our final speaker this morning is Dr. Shazma Mithani. Dr. Mithani is an assistant clinical professor in the Department of Emergency Medicine at the University of Alberta, as well as an emergency physician at the Royal Alexandra and Stollery Children's Hospitals in Edmonton. Dr. Mithani.
Thank you, Dr. Beach. I would like to give a perspective in the emergency department on how the variants of concern are affecting our emergency departments more recently. So one of the things that the variants of concern are making more challenging is the flow of hospital patients throughout the system. Previously in the second and the first wave, we were able to cohort COVID patients together in the same room. So we could have anywhere from 1 to 4 patients, all COVID positive in the same room. However, now with the variants of concern becoming more of an issue, we can no longer do that because we can't have someone with the wild type COVID and one of the variants of concern cohort into the same room. So that basically effectively reduces our hospital capacity. So a room that may have been able to hold 4 patients previously can now only hold 1. The way that that has an effect on the emergency departments is that, as it always does, it has a trickle down effect. So if we can't move patients that are admitted upstairs into the COVID units, they stay in the emergency department for longer and then increase our wait times. And so what I've seen just in the last month or so is that typically on a busy day, on a busy evening in particular, we'd see our wait times sit around 2 hours or so. Just in the last 2 to 3 weeks, we've seen those wait times skyrocket, sometimes up to 5 hours for waiting times in my emergency department. And that has an effect, a profound effect on the ability to see patients who need care. One of the other things, as Dr. Niven had kind of alluded to, is just the healthcare worker burnout that we are facing in this third wave. It's been a long year for healthcare workers, and we are extremely burnt out and exhausted. And I'm seeing a lot of my nursing colleagues take sick time because they are too exhausted to come to work. They are too burnt out to come to work. And unfortunately, what that means for the emergency department is that we have to close beds. If we don't have enough staff to keep those beds open, or they're not safe enough to keep open, we cannot have them as usable care space. And that again contributes to the loss of patient space that we can see our patients in, and again, increases wait times. So what that means for the general population is that if you come in with a heart attack, if your mother or father come in with a stroke, if your son or daughter are in a car accident and need emergency care, they are going to be waiting longer to be seen by a nurse and a doctor because our wait times are increased dramatically because of the reasons that I just mentioned. So there are multiple reasons that have been talked about in this presentation that are affecting our healthcare system because of the variants of concern. And we think it's now time for a call to action. The government needs to take action. All levels of government need to take action to prevent a higher peak in this third wave. And in particular, what we're recommending today is an immediate lockdown or circuit breaker, and essentially a stay-at-home order, as Ontario is going to implement today. So we are asking that people only leave their homes for essential services. They only have contact with members of their own household or their cohorts. We also ask the government to ask AHS environmental inspectors to have stronger enforcement of the restrictions and issue issue tickets and enforcement for those who are not following the public health guidelines. And then lastly, we move on to vaccination. So we'd like to see an acceleration of the immunization program for healthcare staff, especially non-AHS staff in the community who are directly involved in patients, including people like phlebotomists or people who draw blood, community physicians, nurse practitioners, pharmacists, and then of course, perhaps most importantly, frontline workers and essential workers. So these essential workers we're seeing are disproportionately affected by this third wave of COVID. And so it's now time to protect those who protect us. Thank you for your time, and we'll now move on to questions and answers.
All right, thank you, Dr. Masani. Today we will use the virtual raise hand feature within your Zoom toolbar. To use this feature, first select the reactions button and click on the hand raise button at the bottom of the screen. If you're on an iPhone or an iPad, this will be under the more options menu. Once your hand has been raised, you'll be added to the question queue. I will call you by name and you can pose your question to the panel. If your question has already been answered, you can lower your hand the same way you raised it. We can now stop the screen share. Panelists, I'd like you to come off mute and turn on your camera to commence the question and answer period. We have a question here from Audrey Nauvoo. You can go ahead and unmute and ask your question.
Hi, thank you very much. I appreciate it. I would like to know from all the panelists today, what do you think of the vaccination / lifting of restrictions plan that was presented yesterday by the province? Does linking the restrictions lifting to vaccination and immunization a good idea in your opinion?
So I'll take a first crack at that since I have a little bit of experience with provincial programs. I think it's right to maintain a positive focus on what has been achieved and where we're going. And so it is absolutely clear that once everybody is safe, and that means that they've received the vaccine, that'll be the real end of this. And so I think it was right to focus on that. I mean, the positives so far are that, as I pointed out, the mortality rate is staying relatively low, which is a good thing. That Albertans, by and large, are doing the right thing in their lives to protect themselves and their communities. That we have beaten this wave twice with the kinds of measures that we're talking about is a positive as well. But I think if there's one lesson the rise of the variants around the world has given us, it's that any idea that we can get out of this by allowing lots of people to be infected is a truly bad idea. That is the way that we ended up with countries with high mortalities, with hospital systems that were collapsing. And now we know that it's a good way to encourage variants that are even faster moving and more deadly. So the way to get out of that is to ensure that as many people are immunized as possible so that we can close the book on the variants as well as the losses and sorrow.
May I ask a follow-up?
Yes.
What would be, in your opinion, a good target for herd immunity? In the plan that the province presented, the last stage would be around 72% of people immunized. I'm wondering if that's a good goal to look forward to.
It's reasonable. The scientific evidence so far is that somewhere between 50 and 80%, but is in the right ballpark. And but I just want to emphasize that the important thing in terms of the third wave are the number of immunizations that can be delivered in the next couple of months. And we have been calling to make sure, for the government to make sure that they can substantially expand the capacity to immunize per day, not by 10% or 25%, but for 2 to 3 times where they are now, once there are enough supplies to be able to do that reliably.
Can I please add to this? So with the herd immunity threshold, the answer is basically we don't know when we can achieve it mathematically, because we don't, in the equation there are too many unknowns. we don't know the efficacy of vaccines against transmission, and we don't know what R0 value is for the old variant and new variants. So if it's above 3, then we won't reach threshold of herd immunity. So basically, we should start thinking about vaccine as a tool helping us to go to as low numbers of infected people as possible, but not hang out so much of this threshold of herd immunity, because maybe with new variants it won't be achievable. So thank you.
Thank you. Our next question is from Colette Durowitz.
Hi there, it's Colette from the Canadian Press. I heard that the restrictions that were brought in yesterday are just not going to be enough. If you could just elaborate on what you think would be enough, that would be great.
So could you please repeat the question?
Just looking for you to elaborate on what you think would be enough in order to bring down the curve. It sounds like we're in pretty bad shape right now and only going to get worse. So what types of restrictions would you think we need in order to get to a space where we're not rising as quickly as we are?
So to not rise as quickly, to bend it, basically we need restrictions like from last spring at least. We remember all the measures that were in place. So basically everything that was non-essential was shut down. There were some travel limits, and so at least restrictions like this. And there were limits on gatherings, on private gatherings and public gatherings, but mostly the closure of non-essential businesses, including in-person schools. And it will probably just, it still leaves us in a vulnerable, like Dr. Jenny said, that those models are conservative. The P1 variant is not included in it. And P1 variant is maybe much faster than even B117, so UK variant. So then if P1 variant grows more and it's really much faster, then even the spring restrictions won't be enough. So to be sort of in a safe spot, to really bend the curve, we would need something like a full financially supported lockdown, like the one that was in Austria in the first wave, like the one that was in New Zealand or in Australia in their second wave.
Just to add a little bit to what Dr. Kasparowicz was saying, it's clear that the restrictions that the government announced yesterday are a good thing. They're going to potentially slow the rise and buy us some time. But what her modeling shows is that it's not enough to bring the numbers down. They'll rise more slowly, but they're not going to come down. And so we have to look as individuals, as leaders, and as government to what could be done differently. And the key elements of that are for people to, not go indoors into spaces that are not their own, not to associate with strangers who they haven't already been living with, and the kinds of choices that business owners or faith leaders or municipal politicians or the provincial government make to ensure that people are capable of doing that kind of more rigorous protection of themselves and the people that they care about and their community are the things they're looking at. And so the extreme examples of that, Ontario today is announcing that they're going to a province-wide shutdown, that they're basically issuing a stay-home order. Quebec, which has been seriously affected, actually has curfews in place. But regardless of what governments do, individuals can make a decision now that they're going to up their game and that they're going to do whatever is necessary for their business, for their employees, for their customers, for the citizens who vote for them, for the members of their family, that they will move to a voluntary lockdown kind of footing to protect themselves and the people they care about.
Thank you.
Our next question comes from Alana Smith. Alana, feel free to unmute and ask your question.
Can you guys hear me okay?
We can.
Okay, perfect. Maybe my question's for Dr. Mathani. I know that you mentioned in your calls to action the government needs to enact kind of an immediate lockdown or a circuit breaker lockdown. But of course, Premier Kenney has said numerous times outwardly that he's dismissive of this sort of idea. So I'm kind of wondering, you know, doctors have said this all throughout the pandemic, that this is kind of the way to go, but then it hasn't happened. So I'm wondering what can be done to make sure that politicians are listening and might even enact something like this.
Thanks for the question. You know, that's been the challenge with this entire pandemic. The experts, healthcare workers, scientists across the province have been asking for the province at various times to enact stronger measures. You know, I know that Dr. Hinshaw, I'm sure, has been a strong advocate for doing the right thing in terms of what measures to put in place, but ultimately the decision still comes down to the elected officials that lead the province. I think the best thing we can do is continue to advocate for what we think is right. As Dr. Talbot said, encourage Albertans to continue to do the right thing, whether there are rules in place or not. And I think a part of this advocacy is continuing to reach out on media and social media to encourage Albertans and help them understand that the only way forward right now, especially with how bad this third wave is, with the variants of concern playing into that, is to institute stronger restrictions and essentially have a lockdown in order to curb the spread of this third wave. And again, I think the only thing we can do is to continue to advocate the best way that we can. And we thank you guys for allowing us to have this outlet in order to do so.
Thank you, I appreciate that.
Any additional comments from the panel? We don't currently have any questions in queue, so if you'd like to perhaps make a follow-up statement to that, and just a reminder to participants just to raise your hand and I will add you into the question queue. Oh, we do have a question here from Ashley Jonot. Go ahead and unmute and ask your question.
Hi, I'm just hoping that somebody, because we don't know exactly what the restrictions that were announced yesterday are going to do to the numbers, could somebody with some expertise sort of walk through what you're expecting to see based on these restrictions that were announced yesterday?
I'd like to speak to part of that because I'm sure Dr. Kasparowicz has some numbers that she can share. One of the concerning things that I saw in particular with the restrictions that were announced yesterday was that outdoor dining is still allowed to take place. We have already seen multiple examples of patios being overcrowded over the last several weeks as soon as restaurants were open. We have also heard from Dr. Hinshaw that there have been outbreaks and transmission of variants of concern in outdoor spaces, including restaurant patios. And so one of the things that I expect to see in not the right direction is that with patios and outdoor dining continuing to be open, that those spaces will become overcrowded. We already know that people are not following the household rules in terms of staying within your household and no more than 6 per table. The Premier even mentioned this yesterday, and I believe the Minister of Health also mentioned this yesterday, encouraging people not to table hop, to follow the rules. And this kind of goes back to one of the things that we're asking for is for increased enforcement by AHS officers to rigorously go to these venues and these spaces in order to make sure that people are following the rules. Because as soon as those rules are not followed, that's when we're seeing transmission happen. So I just wanted to kind of put that out there at the beginning before we get into the numbers. Thank you.
Okay, so thank you for the question. I think that we can see something similar that we've seen during the second wave and so-called lockdown, that we had some restrictions introduced before the strongest restrictions were introduced, and it slowed down the rate of growth. So the doubling in Calgary was then not 2 weeks, but every 3 weeks, but cases were still growing. So we might notice a little bit of slower growth, but we won't see, definitely with these restrictions, we won't see the bending of the curve.
Thank you. Is there a follow-up?
No, I think I'm okay. Thank you.
Thank you. We don't have any additional questions.
It appears my raising hand doesn't work.
Oh, okay. Go ahead, Sarah.
Thank you. So I am wanting to ask particularly about schools. We did see in Ontario how they closed them down. There's other provinces that are also looking at putting their focus into vaccinating teachers right away, or just asking schools to hold off after the Easter break and do remote learning. I'm just wondering what your thoughts are and how you feel at this point with Alberta. I know you're saying we need stricter measures, but how are you feeling towards schools right now?
So I'll take a first crack at that. I think one of the issues with schools is that, as opposed to a lot of other things where when you shut them down, you inconvenience the patrons, when you shut down schools, it has an effect on parents, and it has an effect on workplaces. And so one of the things that public health has determined from the beginning is that no matter what situation you're in, closing the schools without making sure that parents can be available for their kids is a bad disconnect. The second thing that is factoring into this is that the new variants are already showing a pretty good ability to infect in school sports settings. There are already several quite large outbreaks associated with schools in athletic kind of events. And so, I think that's a place to start. And then if it's necessary, that schools should probably be the last place to be closed because of all of the benefits. And I think another kind of halfway measure that would be useful is, as we've talked about, is to ensure that teachers are immunized if the schools are going to stay open. But ultimately, the government has to weigh a lot of different factors to make that decision. But if we go full lockdown, then schools should definitely be part of it.
Any additional comments from the panel? Seeing none, there are no additional hand raises. If you have had some technical issues, please feel free to just unmute and identify yourself, and we can field your question. We do have about 10 more minutes left.
Sorry, just to follow up, I'm wondering if, because Ontario did go full lockdown, is there a different sense of data there compared to Alberta, or is the situation much different compared to Alberta? Like, it is an extreme measure. So, and the fact that we're not any really close to that is quite different.
So the biggest difference in Ontario right now is that the ICUs are already being actively overwhelmed. And so there are patient transfers happening from one institution to another. You're right that we're not there yet, but if the doubling time is every week, we're just weeks away from that scenario, which is why we're pushing this.
If I could just add to that, one thing that we noticed in the second wave is that Ontario in particular was a couple weeks ahead of us, right? And so we tend to mirror them in terms of them seeing that spike in cases before we do. And I think that that's where they are in the third wave right now. We have to keep in mind that they have been telling us, right? Our colleagues across the country have been telling us that this is worse. The ICU admissions are worse than they've seen in any of the previous waves. And we need to hear that. We're in a situation, as Dr. Jenny had mentioned earlier, where we have the highest proportion of areas of concern compared to any other province across the country. And so if we look at all of that data and see that where Ontario is, we know that we are heading in that direction. And as Dr. Talbot mentioned, we need to put these measures into place now before we get into a situation like Ontario, where they're struggling to move patients around the province, struggling to keep ICU beds open because of the onslaught of patients that they're seeing that are getting more sick with this variant.
Thank you. We have an additional question from Colette. Colette, if you'd like to unmute, you can ask your question.
I was just going to ask about, we saw Alberta Health Services shut down the Grace Life Church just out of Edmonton today. Obviously that had been operating for a long time. Just wondered if there's any comments on that and how those types of, I guess, enforcement measures might help.
So the enforcement measures are twofold. One, they deal with potential threat in which the behaviors of individuals and organizations could lead to infection in the community in which they're embedded. And the second is that when you enforce them, you send a message, including to the groups that are doing the right thing, that you're serious about whatever your policy is. So, you know, the vast majority of the people of Alberta have been sustained by their spiritual faith, regardless of what it is, through a very difficult year. And the vast majority of those organizations, whether it's an Islamic mosque, a Jewish synagogue, a Hindu temple, or a Buddhist temple, or a Catholic or Protestant church, they've been behaving responsibly and doing the right thing. And so that second point of doing the enforcement to ensure that the message gets out to everybody, including reinforcing good behavior in the people who are making good choices, is very, very important. And that's why we've been pushing that for months. Similarly, you know, restaurants, bars, hotels, any other kind of setting, you know, if people aren't following the regulations and they're not being enforced, you're giving a financial reward to the people who decide not to follow the rules. And that's Albertans hate that message. Albertans, in my experience, will do anything as long as they think it's being done fairly. So that was an important thing to have done.
Could churches, even at 15% capacity, be a potential spreading event? We heard that patios might be an issue. The fact that there's still 15% capacity at churches, is that, and places of worship, is that still an issue?
Yeah, I think that's an important thing. Oh, sorry, Dr. Talbot. I think that's an important thing to point out, Colette, is that when we look at larger places of worship that have a capacity in you know, over 1,000, 15% is still several hundred people all in one space. And so it's definitely a risk. You know, things like proximity to each other, things like masking become important, and then things like ventilation of the building. Typically, places of worship tend to be older buildings. And so if we're concerned about the ventilation in these spaces, if they're in there for hours at a time for religious services, then definitely yes, even at the 15% capacity, this is a huge concern as potential areas of spread.
Sorry, and if I could just add one follow-up comment, perhaps not directed specifically at any one activity, but in general, compliance is a big issue as well. We can have restrictions and guidelines, and if they're not followed, they're going to not be effective at all. And when we're looking at this, we have seen jurisdictions, provinces here in Canada that have had strong compliance, have been able to push through these really uncomfortable restrictions in a shorter period of time. If we choose not to follow them, we will have a smaller impact on the curve. It will take longer to get to safe thresholds, and we may require additional restrictions. So it's critical not only that the restrictions are proper, but that people follow them in order to have maximum effect on the virus in the community.
Thank you.
Dr. Gibney, I see that you have unmuted. Did you want to add to that?
Yes, very briefly, because we're coming to the end, and that is that I think it's really important that we do things properly. I think continuing to do things in half and quarter measures means that we're going to have more people in this way get sick, potentially die, go to ICU. But also, it's going to take us much longer to actually get to the point of getting back to normal again. And so I think it's really important to do this properly, do it quickly. Let's get it over with. Let's improve our vaccination programs and move towards whatever the new normal looks like.
Thank you.
Thank
We
you.
have the final question coming to us from Ashley.
I wonder if we haven't talked at all about how long this full-fledged financially supported lockdown would be in place. Based on the data you have, do you have a sense of how long the province would have to stay in this full lockdown for the curve to bend appropriately?
So thank you. Sorry, I the echo. So to bend the curve, we usually what was observed in previous waves, it could take 10 days to 2-3 weeks to just bend the curve. On average, 10 days. That was from the first wave. So if we implement them quickly and as strong as possible, then quite quickly we can bend the curve. But bending the curve is not the end point, right? We need to get the cases down. And recently I did the calculation. If we have this like New Zealand, Australia type lockdown, then in up to 10 to 12 weeks, we can drive the cases to zero and basically be on the safe spot, in a safe spot, and follow up with vaccinations and everything, and be safe, like monitor for new variants, but not let them grow more. So basically 10 to 12 weeks, we could be in a safe spot.
I also think it's important to note that sorry, I'll just wait for that echo to go away. There we go. I also think it's important to note that the longer we wait to institute these restrictions, the longer that lockdown time is going to be, because our starting point is going to be a lot higher. And so, you know, as Dr. Gutierrez said, the calculations that she's done for, you know, this past week, if we were to institute the measures, it would be 10 to 12 weeks. But the longer we wait, the longer those measures are going to have to be in place for us to get to the same endpoint.
Thank you. This concludes our question and answer today portion of today's broadcast. Dr. Beach or Dr. Mack, any final comments before we close the session today?
I'll give Emily an opportunity before I bring things to a close, Lacey, if she has anything she wishes to add. Hearing none at the moment, I'll begin with thanks to our guests from the media, taking time out of their busy schedule during these challenging times to join us in this important endeavor this morning as a vessel for echoing and evergreening the opportunity for the information that we shared today. So I'm grateful to all of you for that. To the members of the panel, I am deeply grateful for your expertise, your earnest feedback, and your wisdom derived from a lot of hard work over the last number of months, and indeed a year plus now. And I'm hoping that the ears that receive this and the mouths that will spread it will take your wisdom forth to provide us with a platform for positive change in our province and taking our patients and families to a better place. So I thank you all for that. And to the Alberta Medical Association and to the Edmonton Zone Medical Staff Association, to both of you for your platform provision today, your hosting, your co-hosting, and your obviously your quarterbacking have led to an exquisite and well-timed element of a communication strategy for dealing with this third wave and onward of COVID-19 here in Alberta. So my thanks to you all once again. Be safe and be well, and go forth.
Thank you, Dr. Beach.